Here we'll be doing a A to P foot. It will be done on a 10 by 12 cassette at a 40 SID. What you want to do is place the plantar surface of your foot onto the film, and the central ray should be directly perpendicular to the third metatarsal phalangeal joint. And with this, you see all the phalanges of the toes and the distal metatarsal of the toes. So, MCP right here. We'll be doing a medial oblique foot. So what you want to do is have the plantar surface of your foot onto the film, and then you want to internally rotate your foot at least 30 degrees inward, and then you will have the central ray perpendicular to the third MCP joint, and you'll still get a view of all the phalanges here. And you don't have to collimate the entire part. You just collimate up to the toes in this area. And again, 10 by 12, 40 SID. Okay, here we are doing our toe, our first toe lateral, which is basically a medial to lateral projection. What you want to do is have the foot in, like the patient will be sitting on their side, and have the foot in a true lateral position. So to get that projection of the first toe, so what you'll do is, I have a tongue depressor, but all I have is a pin. You would move these toes in the back and separate your first toe from the rest of them, and it'll be like this as your patient holds the tongue depressors and the central ray directly through that first through that MCP, through that metacarpal joint of the first toe. Okay, here your patient will be standing straight up, and this is our A to P foot view. So with this, you'll place the plantar surface of your foot completely on the film, and with that, your central ray will be directed perpendicular through the middle of the foot, or 10 degrees toward the heel. What you'll get to see with this view is your phalanges, metatarsals, cuneiforms, cuboid, and navicular. Okay, here is our medial oblique view of the foot. So what you want to do, you want to put the plantar surface on your foot on an image receptor, and then you want to rotate the foot and the leg medially like 45 degrees. So it'll be a 45-degree angle they will be on. And then your metatarsals should be at that 45-degree angle as well. The central ray will be perpendicular through the middle of the foot at the base of the metatarsals. So it will be right through this area. And it allows you to see the articulations located lateral aspect of the foot. And you get, even if you choose the lateral oblique, you can demonstrate the articulations on the medial side, and the opposite for if you are doing the medial oblique, you can see which is most commonly performed here. Here we have our lateral foot view. With this, you would have the patient rotate the foot in a true lateral form, and the plantar surface of the foot should be perpendicular to the film. The central ray is directly perpendicular through the metatarsals of the center of the film, so in this area, and you will get to see a good demonstration of the lateral projection of the bones, which include the tarsals, metatarsals, and phalanges, and also the soft tissue of the foot.